I'm Jaigris Hodson, and I'm a misinformation researcher, also a cancer survivor. Today I'm going to share with you my hope for the future of healthcare. It's one in which everyone in the system can feel the care part of healthcare. And this, I hope to show you, is actually a way we can fight some of that health misinformation. But first, let's talk about what I mean by care, right? For the presentation today, care doesn't just mean the medical help that we give to patients. We already do that super well, right? What it means is attending to that squishy part, the emotions, the psychological needs, the fears, the hopes, the dreams, really seeing our patients. Like in this photo, where the bigger boy is maybe our healthcare professionals, and the smaller boy is our vulnerable patients. Care means taking the time to make people feel safe. It means taking the time to give that little bit of sweetness, and it means remembering how fragile the people are that we see every day. That can go for colleagues too. Care means not just seeing the patient as a disease to be treated, but seeing the patient as a loved one, kind of like a member of our family. But I know I'm preaching to the choir here. You already do that already. I don't have to tell you how important care is. And I know that sometimes we wish we could provide more, but the system prevents it, right? The system is really well set up for treating disease, acute or chronic disease, but not the dis-ease, right? That you feel as a patient, that mental turmoil, that emotional turmoil. This system is not really addressing that yet. And we don't always have time to do that. There's so much to do. But we have to think about that. Because when we don't treat that emotional and that psychological dis-ease, patients, I've seen it myself, turn to misinformation for answers, and they turn to misinformation for comfort. The emotional and psychological dis-ease of simply being a person in the world, let alone a patient, is immense. And I know from personal experience, because in July of 2021, I was diagnosed with stage 3 breast cancer. I felt so alone. It was during the pandemic. Healthcare workers were run off their feet, and I couldn't even sometimes bring family members with me to appointments. And then in the middle of chemo, my oncologist left his practice and nobody told me. That and the way we run the system right now, you call in with your patient number, you get these little cards in the mail for your appointment. I didn't feel like a human being. I felt like a number. And so that led me to feel sad, that led me to feel scared, that led me to feel discombobulated. And these are all emotions that cancer patients feel. These are all emotions that many patients feel. And those emotions are what drive the misinformation entrepreneurs, those snake oil salesmen, to get sales, right? This is what I imagine other cancer patients feel like too, right? All of this mess in your head, you're just scared and you're alone and you can't understand it. You want that emotion to go away. Misinformation provides a solution to that. It provides a solution to anxiety. This is how people sell bogus cures. Chemo is terrifying. Radiation is terrifying. Surgery is terrifying. And if you can avoid that, if somebody's like, oh, you don't have to do that, here, eat this supplement, right? People are willing to do that. And I've seen it. I've seen cancer patients younger than me die because they turned down chemo for misinformation. And COVID's another example, right? We remember what was with all the people who were anti-vaccine and anti-mask at a time when science told them we needed it. It was because it was fear. It's a global pandemic. And we wanted to feel, those people wanted to feel like it wasn't as scary maybe as it was. So that's the draw of misinformation. But there's something else we can do, right? And that's where I come back to the psychological and emotional care that we all need so well. We can metaphorically hold our patient's hand, walk them toward that big scary thing like chemo, and that will help to alleviate the anxiety. And that will give people somewhere else to turn instead of misinformation. And that trust that Christine spoke about earlier, well, that's in there too, because when we show that emotional and psychological care, our patients will trust us when we say, yeah, you gotta do chemo, or yeah, you gotta get that vaccination. And that's why it is so, so very important. Now, I'm standing up here and you're like, hey, I'm already run off my feet. What am I gonna do? The system needs to care for health workers too, right? We can't provide care to others if we're not cared for ourselves. And we know that the system's not currently in the best of shape to do that, even if we all really, really want it. And of course, with the gray wave, the boomers coming into more complex health conditions, it's going to get harder, not easier, to give that kind of care and to have that kind of care for those who work in healthcare. Health workers are amazing, but we're also very, very stressed out. Because in some cases, when there are not enough nurses or doctors to go around for all of the patients that need care, you're thinking, I just got to do the minimum to make sure my patients don't die and get out of the hospital or in the clinic or wherever they are, let alone, right, holding their hand and walking them towards the big scary thing. But care will help with some of that too, right? Because right now we're in this vicious cycle where recruitment and retention can't keep up, compromised care leads to burnout, people leaving, and then the cycle continues. But if we cared for our people, then they would want to stay, right? And that would allow our healthcare workers to better care for our patients. We have to try. Misinformation threatens patient lives. And stressed out healthcare workers are no good for anybody, and burnt out healthcare workers are no good for anybody. So we need to keep the care in healthcare and escalate it. Which brings me to my hope. I want a robust system in which healthcare workers experience a depth of care that allows them to care for patients. I want patients to feel loved, not just treated. And I want healthcare workers to truly feel valued. And I want all of us to work together to make that a reality. Thanks.